Hello, Tongue Squad. I'm Dr. Dawn Moore, also known as the Tongue Doctor, and today we are going to talk about orofacial myology. Orofacial myology is the study of orofacial muscles. So what are those orofacial muscles that we're going to talk about? That is the lips, the tongue, the jaw, and the cheeks. And believe it or not, all those are muscles. And so the study of orofacial myology and that field itself looks at how those muscles are functioning and resting. And what we need for those to do is to function and rest correctly so that we can grow a nice, healthy face and straight teeth. Believe it or not. In the field of orofacial myology, we have orofacial myologists. And those are the people that are qualified to work in this area. And typically, orofacial myologists are certified speech-language pathologists and also registered dental hygienists and other dental professionals that typically do this type of therapy. And this therapy is called myofunctional therapy. It is the therapy that orofacial myologists do and use to correct those resting postures. So when you have a problem with the muscles of the face not doing what they need to be doing, that is called an orofacial myofunctional disorder, or OMD for short. And typically, these can fall into a variety of categories. One of them that's pretty common is open mouth breathing. And for whatever reason, the patient cannot breathe through the nose, and they adopt an open mouth breathing process. And that creates another problem in the orofacial complex because you have to lower your tongue to be able to breathe through the mouth. So then we get what's called low resting tongue posture. And so that's another problem with the tongue not resting where it's supposed to help grow the face. One of the things that a lot of people might have associated with myofunctional therapy is tongue thrust. That might be something that you've heard of before. And a tongue thrust is kind of a misnomer because a tongue thrust is this swallowing action that happens where, if you think you've ever fed a baby before and they push the food out through the teeth and out of the lips. But the tongue thrust is not what does the damage. It is that low resting tongue posture that is not resting on the roof of the mouth, the palate, where it's supposed to, that causes damage to the bite, the teeth, and basically the face. And so tongue thrust, even though that's a common term, it's not really the one that's doing the damage. The low resting tongue posture at night or during the day when children are sleeping is where the damage is happening to the teeth, or adults, because your tongue can move your teeth as an adult, which a lot of people might not know. And so that's another way that we get involved in terms of doing myofunctional therapy. Oral ties is another area where we are working with patients to help them figure out if there are oral ties that are affecting what is going on with their muscles, because these tongue, lip, and buccal was cheek, and these tongue, lip, and buccal ties can often affect the resting postures of the muscles, meaning that maybe the tongue frenulum is not allowing the tongue to rest on the roof of the mouth, which is known as the palate. So sometimes that has to be addressed. And then there's also some lip ties. Maybe the lip frenula are too tight and keeping one of the lips, maybe the upper lip, pulled up. Sometimes they go through the central incisors, the front teeth, and cause a gap. And so there's different ways that kind of happens with those lip frenula. And then we also have buccal frenula. A little less common to be a problem, but if they are too tight, sometimes they can cause problems with the cheeks just not being able to function very well. And they can just put some undue pressure on the teeth as well. So these OMDs, unfortunately, can be linked to a lot of health problems that people might not be aware of. One of the common conditions that we see a lot of, especially in older patients, are migraines or just headaches in general. And we see TMDJ, temporomandibular joint dysfunction. We see those issues as well because the tongue is not doing its job. The muscles of the face are not doing their job. And these OMDs lead to improper chewing and swallowing patterns that further make these issues, that snowball effect I talked about, make these issues a little bit worse. And it just basically ends up being this muscle function that is not doing what it needs to be able to do to grow that face the way that it's supposed to grow and allow the teeth to come in nice and straight and have a face that actually can support 32 teeth, which would be really nice. So we do see a lot of asymmetry in faces. We take in our evaluations for myofunctional therapy, we'll take pictures so that we have some before and after so we can show the changes or in asymmetry. And then we have some poor breathing, as we talked about with the nasal breathing not being a typical pattern for people with myofunctional disorders. A lot of times they'll breathe through the mouth, and some of our patients will breathe through the mouth at night, but maybe not during the day. So nasal breathing is okay, but when they lay down, that changes completely. That's a whole nother ballgame. So we have patients that have issues there too, and that leads to that poor sleeping habits, those poor breathing habits, and all of those things, especially that breathing and sleeping piece. That's such an important part of the myofunctional therapy process because we want to get those lips closed. We want to get you breathing through the nose, that tongue resting up, and then we want to have no movement on the subconscious swallow so that we're not using our facial muscles to help us swallow. So there's a lot of processes that go into, a lot of parts that go into getting us to that point, but that is the overall goal of what we're looking to do in myofunctional therapy. A question that we seem to get asked a lot is orofacial myology new? Because for a lot of people, they haven't heard of it before. And no, it is not new. It's actually been around for over 100 years. And it is a field that was born out of dentistry. And so there was an orthodontist by the name of Dr. Alfred Rogers, who is considered to be the father of myofunctional therapy. And he created a program based on a paper that he wrote on living orthodontic appliances. And it was a muscle-based series of exercises, which ends up being myofunctional therapy, that he created to basically make your muscles be the braces for your teeth so that your teeth grow in straight and aligned. And his teacher, who is considered to be, who was an orthodontist, he's considered to be the father of orthodontics, is Dr. Edward Engel. And he believed that mouth breathing and nasal obstruction was responsible for malocclusions and that would affect the alignment of the teeth. Then in the 1950s, there was an orthodontist, and his name was Walter Straub, and he began working with speech-language pathologists to treat abnormal swallowing. In the 70s, there was a dental hygienist. Her name was Marjorie Snow, and she created and developed a curriculum at the Kalamazoo Valley Community College in Michigan for training dental hygienists in how to do myofunctional therapy. That program is still in effect today, and one of my trainers, Becky Ellsworth, is the one that is leading that program now and still using that curriculum to train dental hygienists. And then in the early 70s, we had the International Association of Orofacial Myology was developed, and that is an association that trains and certifies orofacial myologists. And it is also an agency that is an association that is still around today. So people then ask, why haven't we heard about this until now if it's been around for a really long time? And obviously social media has definitely increased awareness of myofunctional therapy and orofacial myology, which I think has been great, because when I was trying to get help for my child 12 years ago, it was nearly impossible to find anybody. So I really do appreciate that this information is getting out there. But the other reason I think is that mothers and families are looking for more holistic approaches to be able to help their children. And myofunctional therapy through muscle-based exercises is definitely more of a holistic approach versus more of a traditional medical model. And so that's one of the reasons that I think that we're seeing improved and increased awareness in this area. And in my presentations that I do for orofacial myology, I always use this quote I tried to find if it was true, but it was supposed to be by Dr. Charlie Mayo from the Mayo Clinic. And he talks about public health measures. And he says, if you ever want to use some type of, get a public health measure out into the public, then you need to start with the women. And his rationale was because women will fight for the health of their children. And I firmly believe that is true, because that is what I have done since my children were little, trying to get them help for these issues that I kind of knew were connected, but I didn't know how they were connected, and didn't really know enough about what was going on in the underlying processes that were happening to them when they were little. So it's another reason why I'm trying to get this information out there, because I want parents to be aware that there is help. And there's a lot more help 12 years on from when I started to this point. And so you can get help for these issues, these underlying muscle-based issues that are going on with your children, and be able to get them help in a much earlier fashion than I was able to help my children. So I'm hoping that this was some good information for you, and that you got a good overview of what orofacial myology is. I touched a little bit on myofunctional therapy, but we'll do another video on that soon. And until then, don't forget, keep those tongues up.